hand washing.
Yeah. I love that.
As long as you wash your hands before and after each patient. Where is my hand sanitizer? Adriana, let's pass this hand sanitizer up here. All of you, maybe at one point in time, thank you so much, have been in the healthcare field, and you're waiting to have your blood drawn, or you're waiting for the physician to come in, and you see them do this. They walk into the room, they've just seen another patient, and they do this. Okay, Mrs. Green, let me feel your glands. I'm just gonna see, you have a sore throat. It's like, okay, that's not hand washing.
Right.
That's not a substitute for hand washing. When I take my mom in to get her blood drawn, I don't say the phlebotomist wash her hand. She goes and she does this, and she does this, and it's like, and it's not even like this, but more like this. It's like, okay, and that's supposed to make me feel better. How?
Make it manly.
And do I stop her and say, will you please go wash your hands? No, because she's going to give me the evil eye. I'm afraid of her.
They sure is, but you can't. It's all right to do
They
that.
scare me. Some of the phlebotomists scare me because I'm afraid that they're going to give me the evil eye.
Yeah, they are.
Dare you ask me to go wash my hand? I'm afraid. The doctor walks in, and it's like, you can hear the shark music from Jaws. And he's coming at me with his hands. I was like, no! How many people have you already touched before you've come into this room?
But if you're trained in that to begin with, it should become second nature.
It should be habit.
Yeah, I mean, if somebody questions you about it, you shouldn't get upset.
Of course not. But you know that, and I know that. But how many times have you been in a situation where it's like you're just afraid to even like tap them on the shoulder or just ask them a question? It's like, and we shouldn't be that way. We shouldn't be that way. We should be able, if somebody, even if you washed your hands and a patient says to you, could you please wash your hands before you draw blood on me? Do you answer A? Well, I just washed my hands before I came in this room. Or B, of course, be my pleasure. B. Really is telling them with your hands on your hips going to make them feel better that you told them you washed your hands already? No, it's just going to make them afraid. If you're going for the fear factor, then it would be A.
I've been doing this for 10 years.
Thank you. Yeah. I know what I'm doing. Or if they see you take a needle and you inspect it to be sure the seal's not broken, and you break the seal, the patient's watching and says, could you use another needle? I think that seal was broken. Do you A, say, oh no, that seal wasn't broken. I just broke it. There was no break. This would be fine. Or B, absolutely. Let's get another one.
B.
B, it's more therapeutic, isn't it? A just makes you look like, somebody that doesn't like their field. I used to keep in my pocket because I ran into nurses all the time who really shouldn't have been in the nursing field. Nurses, aides, it's like, how in the world did you get into this field? How did that even happen? They've got the superiority complex. They've got the authority complex. They've got, so I was driving down, it was in Taylor, I forget what road it was on, it's called Burt's Trucking. I ran and got some coupon flyers. And when I would see a nurse be rude with a patient, or I'd see, a nurse's aide, not treat people like they should, we have mailboxes. And I would slip the Burt's Trucking coupons into their mailbox. Like, hit 50%, $100 off, 3-week trucking. Get your CDL license. They belong behind a rig, so whatever they dish out, they can get back from the other truckers, right? Because patients aren't going to dish it out because they feel vulnerable and helpless. So,
Nancy, there was 2 other things I noticed when I was shadowing. The girls would always use the same tourniquet for quite a while.
What do you think about that?
I don't like it because
why?
It's close to the blood draw. And they wouldn't wipe the seat down every time, you know. So you have a blood draw on the arm of the chair, excuse me. And now you have me reflecting back now.
Yes.
What's missing?
Reflect.
Yeah.
You should have a new tourniquet for every
Yeah.
patient.
And she had a whole box of them.
Sure, she could use
But
it.
she would just put it on the arm of the chair until the next one came in.
And the arm of the chair, yeah. Tourniquets, which you're gonna get today, because we're gonna do tourniquet time today. I got some tourniquets in here, I have to get them from the front desk. But you're gonna get tourniquets. Tourniquets, imagine, I like to use this example. Somebody comes in with shingles. It's a form of chicken pox, right? They're sores, they bleed. You don't even know, they've got it right here. You're not even gonna look behind their arm. And they just broke when you put this tourniquet on them. Okay? So now the next person who comes in is an end-stage AIDS patient who has no immunity whatsoever. You basically, by putting this tourniquet on them, just kill them. Because they're not gonna be able to fight the varicella shingles virus. Right?
And actually that happened, a similar happened. I had shingles last year. I had to go in for colonoscopy.
Okay.
And after I started drinking that solution, whatever they give you, 48 hours, whatever, I started noticing these blisters started appearing on the inside of my leg, and I had no idea what they were. So I went in for the colonoscopy the next day, and a nurse came up and she was getting me ready and everything, and I said, oh, and by the way, I need the doctor to look here and tell me what these are. She was pregnant. And the doctor came and he looked at it and said, you're not even supposed to be around him, he's got shingles. And so we had to postpone it another week or so because of that, because the shingles had flared up so bad, and it's contagious at
Very
early
contagious.
onset.
Yeah. No, it's very contagious.
Until the blisters break.
Right.
Yeah.
Oh, God, and they dry up. Oh, it's
Yeah.
very contagious, very painful too.
Oh, it was horrible.
But point being, these are a source of infection. Okay, now here, because you're only going to use like 1 or 2 people, you can use one. I suggest these are $1 a piece. If you need to buy a lot of them, you can. Okay, but typically our students draw on 1 or 2 people, always the same people. But you want to take care of these. So I want to tell you to have them in a paper plastic bag, keep it sealed, because if they start to get nasty looking, you need to get another one. Okay, you don't want to use these. But in a hospital, when you're going from room to room to room, chuck them. Outpatient lab, throw them away. I had a phlebotomy teacher that taught with us for a while. Do you know, she told me that they used to reuse the hubs. They would bleach them, they would clean them, and they would reuse them. The hubs.
Why the
It was a
reluctance?
hospital.
Why the reluctance to throw them away?
No, I don't know. I throw everything away. I teach you guys that even if you set up at a table and let's say you're not ready, you don't feel comfortable with the draw, but you haven't used the equipment, I have you throw it away. Because this way, you'll always know that you're developing the habit. If you don't use it, you throw it away. If you've prepared it as if you were going to use it because the intention was there to use it, you throw it away, because that way you'll never run the risk of saying, did I open this needle or not? Right? So I don't care how much you waste. I'm going to show you how much paper I waste when I wash my hands too. When people used to come in from ER with their IVs, or I'd have a patient with an IV bag, and I couldn't see the date on it, or the initials, or I might see the initials of the person who started it, but no date. Usually what I do is I get rid of the tubing, and I change the bag, and I change the IV, because I don't know how long that IV's been in there. And the longer that something's in you, right, the greater the source of infection, right? So my advice to all of you is when in doubt, throw it out. If you've prepared a Vacutainer needle and hub to do a blood draw and somebody says, may I please have a butterfly? And you say, sure. don't save it and say, well, I haven't used it, I'll leave it for the next person. Throw it out. You had the intention of using it. Therefore, it is used. That's the way I want you to think. That way you're not going to slip up and try to use something that's been used that gives somebody septicemia, which is blood poisoning. Right? All right, we're going to talk about infection. I love the hand washing. You guys are right on top of everything. Hand washing. Always. There's a way to wash your hands, and I'm going to show you, and I know that sounds silly. Nancy's going to show us how to wash our hands. Dave, I'm going to be over here by the sink, washing my hands. You can stop, pause, whatever. Okay, so I want you to watch this. So let's say this is the patient's sink, or even if it's the sink behind the nursing desk. Don't trust that everybody's going to have the same hygienic traits that you have. How they touch. The faucet handles are very dirty. Even though you're going to wash your hands, I say don't touch the faucet handles. So I'm going to grab some paper towel. Thank you so much. I'm going to go ahead and turn the faucet on first using paper towels. The housekeepers at the hospital, they don't like me too much because they're always where I go, paper towel usually ends up gone. You know, they're having to replace it. Try to get warm water, not too hot. Hot water can hurt your hands, right? Nice warm water. Of course, you won't find hot water in a hospital anyway. You have to let it run forever just to get warm. So most of the time you're washing your hands in cold water. So now you're going to rinse your hands. And now I'm going to get some soap. So I'm going to grab another piece of paper towel. Thank you, thank you. Let's dispense some soap. Now you're going to work up a lather. Now this is a medical aseptic technique. Surgical hand washing is 20 minutes. They use an iodine-based soap. They wash up to their elbows. This is just basic medical hand washings. You want to keep your nails short, right? You want to scrub between your fingers. You want to scrub the palms of your hand where MRSA grows. You know, keep your nails clean. Just up to your wrists. That's it. And then work up a nice lather. And now we're going to rinse. Now, I'm not going to rinse from my wrists to my fingers. Why? Because I don't know where that demarcation line is exactly between the soap and non-soap, right? So if I start water from here, whatever area I didn't wash is just the germs are going down to my fingers, right? So I'm going to go from my fingers to my wrists. Because at least that way, I know that I've washed my hands. I think they do it a little differently for CNOC, but they're always switching up. Okay. Okay, at this point, I want you all to resist the urge to flick. We have flickers here, okay? There's always a flicker in one of our classes. What does that mean, flicking? It feels so good to flick it. No, don't. Okay, I'm going to grab some more paper towel. I'm going to dry, since I went from my wrist to my fingertips to rinse. I went from my fingertips to my wrist to rinse. I'm going to dry. Fingertips, palms, wrist, throw away. Thank you. Fingertips, palms, wrist, throw away. Last one. My hands are dry. I'm going to use a dry paper towel to shut off the water. Thank you, Ibrahim. I'm good. And then I'm going to use my paper towel to dispense hand sanitizer. Why hand sanitizer? What does hand sanitizer do? It kills fungi and spores. So that means soap and water doesn't kill fungi and spores? How weird is that? You think soap and water kills everything? It doesn't.
It's a lubricant,
Just to loosen things.
loosen things up, yeah.
Oh, good job, definitions back there, John. Steve, good, yeah. But this hand sanitizer kills fungi and spores. Now my hands feel really clean. Now I'm ready to do a venipuncture on my patient or assess my patient. And I'll put gloves on top of that. But hand washing will prevent the spread of disease. Truly it will. And it's a very important concept that I want all of you to do in class. So even when we're practicing, I'm gonna say, go wash your hands. We're doing tourniquet time, go wash your hands. Right now, I'm gonna have everybody get up and duplicate my method. So what I'd like you to do is, I've got some paper towel here, so one of you be the paper towel person, okay? Because the paper towel that we have up here, which I'm out of right now, the dispenser that where you hit it like this, you don't really want to touch anything. So most of the paper towel at the hospital is what? It comes, the paper towel just kind of pull it out, right? And usually I pull it out in chunks. It never comes out as 1 or 2 or 3. You know, it just comes out like a 3 inches thick. But the point here is you always want to wash your hands. So if I've washed my hands and I've got a door to get out, do I have to touch the door now? What am I going to use? Paper towel. Now you're getting it, right? So what I'd like all of you to do right now is, I'm going to have Ibrahim watch each of you come to the sinks and wash your hands, okay? Or we can just line up with one sink, because I think I have just soap right here. So each of you take turns holding the paper towel for your partner, and we're going to wash our hands. Okay, you guys don't mind being on camera for this? Shall we, you want us to stop running, or are you okay? Are you guys okay with it?
I want to get my good side.
Okay, so hold the paper towels out your
Standing on the other right there.
Don't worry about how much paper towel you use, I don't care. I don't care how many rolls you want to go through. Just do it right. Here's another one. Don't wait, I know. You guys are such good sports being on camera. So the hand washing, when you dry your hands, it's very deliberate, isn't it? You notice how I use paper towel for different parts of my hand? I didn't use the same paper towel. I didn't do this with paper towel. What am I doing if I do this with paper towel, rubbing it back and forth? I'm just moving the germs, right? Very good, yay, thank you. Are you looking for hand sanitizer? Here you go, there you be. Now when you guys go home this week and you practice this, you'll always do hand washing this way, because your hands will feel so clean. And we've got some tourniquets for everybody.
Backwards. She got better lather than I did.
Yeah, you're probably gonna use enough soap.
Yeah.
I actually think you'd be fine, you know, just to dispense the stuff normally. But after you clean it.
Yeah, because I'm using a paper towel every time I. This might be hot.
Just remember to kind of have the water fall.
Yeah, down. I'm not licking.
See, that's a hard break. Yeah, because I do that. I always do that.
Are you feeling John?
Yeah,
Sorry.
that makes sound so bad.
It's more economical.
Uh-huh.
You were thinking economical.
And plus, I'm used to the air ones. The ones where you push the button and the air dry.
Abraham,
Oh,
how did I do?
Yeah,
How did I
missed
do?
that too.
Yeah, you're
I
good.
just, okay.
Just hand sanitizer.
So what about your sanitizer, Jill?
We need that type of.
Fungi and what?
Let's try it over again.
Already.
What does hand sanitizer kill? Fungi and what?
Fungi and
Spores. Spores. S-P-O-R-E-S. Spores.
Excuse me. Just one more time. I'm done, I'm ready.
Good job. Yay!
Different when they
Yay!
call me and see how different they hit me. It wasn't,
I know.
so I'm so used to everything.
Does it make sense though?
Oh, yeah, yeah,
Yeah.
yeah, the hard,
They
the
do
only
do-
hardest thing I ever remember is grab a towel.
Yeah.
That's the,
Barrier protection. Yes, sir.
thank you.
You are very welcome. We must clap for everyone when they're done and celebrate.
What's the difference? It's supposed to be 20.
Just once you
As
touch
long as I
the
get it
bottom,
right, I never
you don't go
find
back
it.
up with the same depth.
Oh, okay.
Because I know.
Yeah, just start up and then go down and that's it. And then
And then
Yeah.
that's
Happy birthday song.
take that towel.
So when we dry, you can see it's,
Deliberate, yes.
Okay, so
Don't dry like this.
don't dry down.
No,
so
every
much
morning
paper
don't
towel.
dry
Oh,
down.
sorry.
Okay.
And every time you use paper towel when you dry.
I was confused with going this way to dry or.
Yeah, fingers, palms, wrist. You still have to run it through the
Yeah. That's why I was confused.
Slow down.
Well, doesn't this really make sense because we were just talking about when you're seeing you're drying down. But then when you're this, I don't know why it would be different in the state.
I watched the video like 25 years prior when we were watching them now, and it was the way I'm showing you now.
Okay.
So they know how to, they'll change it up.
Right.
But like you said, there's no national government, size control over it.
Other than NIOSH.
Or NIOSH, yeah, that's the way it's OSHA. And that's what it's just.
Did I do all right?
Yay, Miss Latoria, congratulations.
Oh, yeah, you can.
Wonderful, good job. Oh, you're very welcome.
Okay.
Need another pen,
Yeah.
Just got so quiet.
I just did that too.
What'd you do? Oh,
Yeah,
yeah.
'cause I'm so used to doing it that way.
Hand sanitizer.
You ready now?
I'm ready. Thank you. Why, you wanna go?
be great at,
Yeah.
you're gonna be great at drawing blood, like washing your hands.
Old habits. Hard-
Yeah, I know.
Yeah.
It's funny when you're being looked at.
Mhm.
Thanks, Aiden.
You guys are great.
Go ahead.
Yeah, I
I'm
know.
gonna shut up.
Yeah, I know. Well, remember she said, they said it was all right to do that.
Did she say that?
That-
That's where
Abraham said that.
Oh, okay.
Yeah, he
Okay.
said, because you're gonna wind up
Yeah.
duplicating that effort anyway.
He probably knows it all. Standing here watching this all day.
I was asked once, by one of my students, how many times do you wash your hands within 15 minutes of being at work? And do you know I tell them? I lost count. 15 minutes. I've already lost count.
Okay.
And actually, see, now that's another
Because
thing.
everything that I touch, if I know I have to go into a patient's room, I have to wash my hands.
I want my hands to be rough, hard.
Fingertips, palms, and wrists. Watch how we dry. Fingertips, palms, and wrists. Don't be afraid to use as much paper towel as you like.
Yeah.
He does this
Is that
already.
Latoria's critiquing you, John.
Yeah.
over there. There you go.
Don't tell me what to do, girl.
It really is difficult.
How you know I know how to do
when
it?
I know.
you're being
I'm
watched.
not gonna get stressed.
It was something, okay. You said that with the soap the first time, we probably don't have to use that because we're gonna wind up, that's the most
You still
important
wash it,
when
you
we're
still
doing
wash
it at the
your
end.
hands.
Okay.
But after they're washed, you don't want to.
After they're washed, you don't wanna touch the soap, other
Yeah.
than to
I mean,
clean
of
it
course,
up.
you already spent the soap, I'm talking about the handle.
These crumbs.
Right,
Yeah.
right, okay.
Good job.
You got nails there. I need my wrists with my sleeves pulled up. Thank you.
You're welcome.
Fall
See.
down.
There you go.
Thank you very much.
So what do you think about jewelry on your hands and long nails for
No.
preserving healthcare?
Ew.
It's not a winner, is it?
No.
What is it with long nails? Why don't we want
Carry germs.
germs,
You
right?
need a nail brush.
Okay. Yeah, nails carry germs.